Hi, everyone. Welcome to the Smarter Systems, Better Care podcast. I'm here today with Dr. Syed Rizvi. He's the founder of RZV, whose expertise in anesthesiology and healthcare technology is driving innovative solutions that bridge clinical care and AI-powered health platforms. Thank you for joining us today.
Thank you for having me, John. How are you?
Absolutely. Good. And just to give our listeners context, just tell us a bit about your background.
So I am a board-certified anesthesiologist. I have a fellowship in regional anesthesiology and acute pain medicine. I'm currently practicing in Connecticut. I'm the fellowship director for our regional anesthesiology and acute pain fellowship. We have part of Charter Anesthesiology. Also, I founded a company. It's called RZV. We're developing AI solutions to healthcare issues.
Excellent. What are some specifics that you're working on today? Like, what's the core focus of your business?
So my big product that I'm currently still developing is called PeriopAI. It's a clinical decision support tool for perioperative medicine. In my current practice, I go to a lot of surgery centers and I work at one main hospital. One pain point that I've noticed at all of these facilities is a restriction or an inefficiency in workflow. I'll be taking care of my patients clinically, hands on. Everything is great from that perspective. But then at the end of the day, when the last patient leaves, I have a whole pile of patient charts to review and go through to make sure those patients are safe at the surgery centers that I work at. And this inefficiency doesn't start at me, it starts much earlier. For example, let's say a patient sees a surgeon to have a surgery performed. That surgeon schedules the surgery. Then the scheduler reviews the patient's chart, and hands it over to a nurse. The nurse then calls the patient, reviews the chart some more, and then compiles more succinct information to give to me. And then I review the chart. When you're doing 20 surgeries a day, that all tends to add up. And with the advent of large language models and artificial intelligence, I noticed that this can decrease that inefficiency, give the nurses, physicians, anesthesiologists more hands-on clinical time without this operational administrative time at the end of the day.
That's wonderful. So it sounds like you got the whole workflow lined out that you're working on to make it a much smoother experience for clinicians.
Correct. Also, as part of PeriopAI, we will also have preoperative recommendations, intraoperative recommendations, and postoperative recommendations to help decrease complications at these surgery centers, which in the long run will result in cost savings because one admission to the hospital from some complication is thousands of dollars.
It's a huge ROI as well, as along with an increased efficiency of the process, removing administration burden as well. Then when you look at your role specifically, where do you spend the most energy kind of driving your growth?
Currently, I'm still developing the product. I'm a solopreneur. My background does not have any formal education in software development, but growing up, I've built websites, I've built applications on my own. This passion of mine started before high school, but was a little more formalized in high school when I took a computer science course and learned Java at that point. I thought software development, technology was always very interesting. I like to keep up with what's going on in terms of technology. And right now, my personal pain points are leveraging artificial intelligence to help me develop these software products.
Yeah, to kind of expedite the process, it sounds like. Absolutely.
The method I'm using to create my products, I don't love the term. It's called vibe coding, where you basically prompt a large language model to help you code. The current limitations of these large language models and interfaces that I'm using is their context window is too small. So I basically have to be an expert prompt engineer and a product manager to simplify what I want in many small steps to achieve a bigger goal.
Yeah, sounds like we're in a lot of different hats as you're kind of developing your product as well.
Correct.
Yeah, and like looking at like the shift in your industry too of like startup founders, like, what's something, especially in the periop space, that most people probably are not paying enough attention to that you've realized?
I think right now it's the clinical workflow. So PeriopAI is currently patent pending. I have a provisional patent. We did a prior art search, and there wasn't anything like this in the clinical realm. There are other companies leveraging AI for operational workflow. such as patient scheduling, prior authorizations, but nothing, as far as I know, in the patient care or clinical realm.
So you're getting into a space where you have the knowledge, obviously, and you can really kind of insert yourself to provide a really great solution.
One positive that I've noticed coding on my own and developing this on my own is there's no back and forth with software engineers. I know what I want. I know what the requirements would be for an active practicing physician and surgery center. Software engineers, like let's say I did use software engineers. They would give me a product. I'd say, hey, this won't work in real life. They'd go back, retinker it, give me another product. There's a lot of iteration there. Currently, I'm doing all the iteration on my own and can hone in on aspects of PeriopAI that I think are most valuable in a clinical setting.
Yeah, absolutely. You own the process. Like you said, you're a product manager, developing it, getting it through to iteration that makes sense where you can kind of pilot it as well. And how have you adapted, to these changes with Periop AI specifically? Like what it happens to, these surgical centers that ignore the shift to AI?
If they ignore the shift to AI, I think they remain stagnant. And by that, I mean they're with the status quo, they'll remain as they are, versus other surgery centers which adopt AI, they'll become more efficient. They'll probably have an increased return on investment in the long run, just because, as we all know, medical reimbursement's going down, over the past so many years. And to optimize savings, to optimize cost and investment, I think it is important to leverage AI and keep up with technology.
Yeah, absolutely. Because and unfortunately in healthcare, a lot of it's antiquated, right? It's an older model, slow to adapt, does not move at the speed of technology, unfortunately, especially with AI. Things are changing by the hour at this point.
Mhm.
By the day, there's huge jumps every single day, right?
Yeah, right.
So,
Aspect of the medical field that makes the startup difficult is iteration is slow, because you don't want to put out a medical product that will be involved in taking care of patients uh, when it's incomplete or not fully developed. Other startups, lifestyle startups, like areas of the world where you're not involved in something as fundamental or critical as medical care, can put out an incomplete product quickly. For my product, I want it to be as perfect as possible before I put it into production.
yeah, absolutely. You want to refine it, fine tune it, and make sure that it's obviously HIPAA compliant. It's abiding by all the security standards out there. That makes complete sense. And like when you're in the day to day operations, where do things still feel kind of clunky or slower that you'd like to see?
Right now, it's the development of it. Like I spoke before, the context windows for vibe coding my software are small. So I have to piecemeal together the code to get it production level. For other applications, it is good enough for a minimum viable product, but not for something production level.
Yeah, absolutely. And so it sounds like, again, you have like a very small window of time to make changes and then get something viable again that you can keep working with, right? So, and then how are you performing like your outreach now? Are you reaching out to surgical centers or are you not to that point yet? Just curious on kind of what you're working on right now in that regard.
Right now, I'm sort of covertly speaking with the nurse directors at the surgery centers, asking them what they think a product like this would do for them.
Yeah, getting
I'm
feedback.
receiving positive feedback. At the same time, I have not specifically told anyone that I'm working on this. So, it's a little bit of R&D without getting everyone's hopes up. There's also logistical concerns with me bringing it up with the surgery centers I'm currently working at, just because although I'm a partner at the anesthesiology company I'm working at, this is separate from that, and there's a non-solicitation there. So I would need approval from the rest of the partners for me to actually solicit the surgery centers I'm working at. There are other surgery centers that I'm aware of that I have connections with through surgeons I work with that my anesthesiology company is not affiliated with. So that's an avenue I will pursue after I'm developed to pilot PeriopAI.
Start getting demos and lining those up as well. Excellent.
Yes, that's fine. I have been getting interest. I've been getting emails on demos from other anesthesiology companies, and we're still in development. So as soon as that's done, I'll be reaching out to them. My target audience for PeriopAI is mostly surgery centers and smaller hospitals. The product itself would be helpful for specific surgeons as well. So I'll have different tiers, and if someone's interested in the product, I'll show them a demo and see if they want to proceed.
Absolutely. So it's exciting. It sounds like a lot's happening. Like what's working really well right now that you would never want to lose in this product making creation phase?
Something that's working really well right now is I think I've almost perfected my methodology in vibe coding the product. I see myself not easily, but efficiently creating other products in the future. So my personal development, leveraging artificial intelligence and large language models, has improved greatly.
Excellent. Yeah, and then the alternative, what's been harder than expected despite all the effort that you've put in this process? Like what's been like a frustrating bottleneck that you've dealt with?
Since I'm still in the development phase, I think an upcoming frustration or issue that may arise is sales. It's not something I particularly have a background in, and it's something that I'll have to learn and develop over time to sell my product.
Yeah, of course. And then just launch it and let it grow exponentially from there, right? Is the dream.
Yeah, but it's okay. The key will be to get a buy-in.
Yeah, exactly. And then like if you're able to solve all these bottlenecks and you got a salesperson or like maybe you hired like a sales development rep or maybe you did the sales at first, which is fine. Like where do you want to be in like 6 to 12 months, even from now? Like what's your goals?
Yeah, so I feel like I will want to start off modestly and ramp my way up. 3 or 4 surgery centers in 6 to 12 months, will be great. If it scales faster, awesome. If it's slower than that, then I'll have to figure out why I'm not getting buy-in, or if there's an issue with my product, if there's not a need for these surgery centers, if they're not interested.
Yeah, absolutely. More like figuring out the go-to-market game plan. It sounds like what you're trying to work on and what that's going to look like. And then, what are other things that we may not have discussed today that others can learn from this MVP process that you'd want to tell someone?
I would say, and this is probably true in other parts of life as well, inertia is important. Just start, keep up with it, keep trucking along. It's a marathon, not a sprint. You're not going to finish in one
Yeah,
day. Uh, there's been points during development where I've lost complete functionality and I've had to, restart from the day before. And these things will happen, but as long as you have conviction and a vision, just keep working and it'll come along.
absolutely. This is determination and it's the ups and downs of the startup company, right? That you're discovering.
Exactly.
Yeah. Well, thank you for your time on the podcast today. It was like a great discussion. Where can people find you if they want to connect?
If people want to connect, I'm on LinkedIn. I also have a website. It's www.syedrizvi.com. Those would be the two places to get in contact with me.
Excellent. Well, thank you for your time today.
All right, thank you, John.